A little over a year ago, I started having some weird arm pains. So around my shoulders, about right here, it felt like a rubber band was around both shoulders, real tight, squeezing my arm. It would come and go. It would last for just a few seconds. I didn't think much of it. As the weeks and months went by, it got a little worse. It hurt a little bit more.
Lisa never mentioned anything about her symptoms, but looking back, she had plenty of symptoms. And I thought they were always because I did something wrong or issues that she had with me, but the reality is that she was walking with her arms folded, complaining about certain pains, tingling sensations in her arms for a long time, for maybe a month or two.
And she kept saying her arms hurt. I remember we went to the theater one night and she came out and she had her arms folded. And I finally said, maybe you should get it checked out, but it didn't concern me at all.
So I just called and I got into, not my regular doctor, but just into any doctor that could see me. And that doctor suggested I see a cardiologist, which surprised me because I didn't know why I would have to see a cardiologist for indigestion, or because I really thought that's all it was.
Lisa's cardiologist was suspicious that she had something going on with her heart and underwent some preliminary testing that led her to have a cardiac catheterization. At the catheterization, she had severe obstruction to her main coronary arteries. It was really quite traumatic. She had a history of radiation therapy as a young adult, but she also had a lot of risk factors for premature coronary disease. So her doctor had a low threshold for pursuing cardiac diagnosis in somebody with unusual symptoms. She didn't have the classic elephant sitting on her chest. She had symptoms in her arms and even up into her neck.
So that morning they came early and wheeled me off. You know, I said my goodbyes to my family, and it was really hard, and I tried to keep it together until I got into the operating room, I remember, and then I was really upset, and the nurses were like, "What's wrong?" And I'm like, "What's wrong? I'm having open heart surgery. You know, it's really scary." And they're like, "Don't worry, these doctors are amazing, and they'll take really good care of you." And then that's all I remember, basically, until I woke up. And I had a lot of pain, a lot of chest pain, because they do a lot of stuff to you. But it's amazing what modern medicine can do.
I did coronary bypass grafting on her with 3 vessels. We are now using arteries rather than veins for most of the bypasses because they last a lot longer. Many years ago, if we had the patient get through surgery and do well for a few years, we were happy, but now we're doing surgery that can last decades. And in that case, we did multiple arterial grafts with Lisa's bypass surgery. Lisa is a good example for women who are concerned about risk of coronary disease. So listen to your body, to do not cast aside symptoms that you've never had before that are really unusual, especially those that occur with exertion, and resolve with rest. You need to listen to your body and see your physician and report these symptoms immediately.
I think my advice for all women, regardless of their age, is if you feel something's a little off, go see the doctor. A lot of women just put it off. I know that you're working, you're taking care of the family, you're busy. You just have life and you don't have time to go to the doctor. "Oh, I'll do it next week. I'll do it next week," but next week might not come.